Good morning, class.
Morning.
How you guys doing tonight?
Fine.
Good.
I want to tell you about the story when I was a young buck back in my day. So I was bored on this Friday night and I wanted to have some sex. So I got on my tractor and I saw this one house, so I went right down and I was like, do you guys have a 17-year-old daughter that wants to have sex with me? Apparently not, because he pulled out a shotgun. So I went right back on my tractor and I went back home. Are you alright, Adam?
I didn't think.
What are you calling to a party, class? You don't look alright. Will you lay on the ground, please?
Is this really necessary?
Do you feel any symptoms?
I have a cough.
You have a cough?
No, I'm just doing this for fun.
You have a hot fever?
I do. Yeah, I'm hot as heck.
Open your mouth. I got a thermometer right here. Oh boy, that's a very high fever. That looks like a symptom of typhus. Class, come up. This is a live case study. Alright, class, so symptoms are clearly a fever and a cough. Let me check his lymph nodes real quick. Oh, those are very swollen. That could be easily regional or generalized lymphadenopathy, as well as eschar.
Hot rod.
Yes, Martin?
What are those?
Oh my goodness, Martin, that is a great observation. That is a rash. Extra point for you. That is also another big symptom of typhus. Johnny, will you please call 911? This poor man's really sick with typhus. Stop coughing on me, sir. I don't want to get sick.
Yeah, hi. We're at Ohio Northern University and this kid has typhus. Yep. Hot Rod says so. Alrighty. See you soon.
Whoop. Got that out of the way. Now that Adam's in the hospital and we were able to experience a live case study, I thought I would just put this new disease on the test. So more about typhus. We're talking about the symptoms already. Let's now talk about the pathogenesis. So, the pathogen usually enters a human when lice excrement comes in contact with the area of a flea that is bit or any open wound on the body. You can also enter a human if the flea excrete is inhaled or if it comes in contact with any mucous membrane. Once the pathogen attaches to the endothelial cells, phagocytosis is then initiated in order to destroy it. Phospholipase A2 facilitates the pathogen's escape from phagosome before fusion with a lysosome and enters the cytoplasm, where it will then rapidly multiply. After the multiplication, it will then be released into the rest of the body by lysing the host cell using enzyme secretion of phospholipase D and homolysin C. The pathogen will then infect the surrounding cells and will end up damaging many endothelial cells. Low blood volume and edema can result from the vascular permeability caused by the damage that the pathogen inflicts on the endothelial cells. Low blood pressure and organ dysfunction can also occur. Then this pathogen will then exit the body when non-pathogen carrying lice feed on the blood of an infected human being.
Hello, so from what you said on the phone, it sounds like you're having symptoms of typhus.
Okay.
So we're going to run a few tests in order to prove that. You probably got typhus after being bit by an infected louse or flea, and then if you scratch the bite, you push the pathogen into the wound and into your body. Depending on which insect you got bit by, there are different pathogens that cause the disease. If you got bit by a louse, you'll have Rickettsia prowazekii. But if you got bit by a flea, you'd be infected with Rickettsia typhi. Both of these pathogens are gram-negative, rod-shaped, and vector-borne bacteria. So in order to find out if you actually have typhus, we'll have to take a biopsy of your skin where the rash is, and then stain it to look for the pathogens. Well, we've got your results back, and the official diagnosis is typhus. We're going to treat you with doxycycline. You'll take 20 milligrams by mouth once, and then you're going to follow that by 100 milligrams twice a day for 5 to 7 days. In order to prevent becoming infected by typhus again, you should try to control the rodent population around where you live, as they tend to carry fleas. Also, you can use pesticides to treat individuals and large groups that have lice. Lastly, you can boil or wash your clothes that are infected with lice for about an hour at 70 degrees Celsius, which is also 158 degrees Fahrenheit.
Okay.
You should start feeling better soon.
Thank you.
You're gonna start coughing and you're gonna be like, oh my god, I think I have a fever. I'm gonna come over here and take out the thermometer. Oh my, those are definitely swollen. That could be regional or generalized. Lean muffin. Oh yeah, those are very swollen. That could be either regional or generalized. I'm gonna tell you the story one time when I was a young lone buck back in my day. So, back in my day, I was kind of bored and I wanted to have some sex. Okay, stop.
Oh, if you would have known, if you would have kept going, that would have been fun.